So the rotator cuff are a series of tendons that attach to the top of the arm bone. And like its name suggests, it helps to rotate the arm. Unfortunately, some of these tendons are sometimes damaged. And so the idea of rotator cuff surgery is to repair that damage to enable the tendons to perform their function again. So the operation itself involves a general anesthetic, and usually the anaesthetists I work with also numb the arm so that there's no pain when the patient wakes up. The operation is performed by and large with keyhole surgery, meaning that there are 4 or 5 small little holes around the shoulder itself, but no large incision. We then insert little pegs into the bone, out of which suture or a type of string comes out, which we then put through the tendon and tie it down back into place. The operation lasts usually about an hour. So the recovery time varies from person to person, but by and large, I'll tell people that the little holes in their skin heal over the first 10 to 14 days, at which point the sutures are removed. Their arm is in a sling, but they can take this off initially just to stretch out the elbow. Most of the time they're in the sling, however, for the first 6 weeks. During this time, we will start to get some very slow movements going with the physiotherapist guiding the movements that they're able to perform. After 6 weeks, we increase the range of movements slowly. And at the 12-week mark, following surgery, we then start to strengthen everything back to normality. But it's during this time that it can be a little bit uncomfortable. The success rate for surgery is usually pretty high, to be honest, with pain relief and functional gains, not straight away, but in the longer term, after 3 to 4 months, it's definitely noticed. There is a re-tear rate, so the tendons do re-tear afterwards, and this is accepted by all surgeons, but it does depend on the quality of the tendon that we're repairing, as well as the technique involved sometimes. The complications are broken down into general complications for surgery, such as infection, a bit of numbness over the wound sites, a bit of bruising that comes out. And then more specific complications to do with the actual surgery itself, such as stiffness of the shoulder, ongoing pain, the re-tear of the tendon itself, and even potentially clots in the arm, but this is extremely rare. You should not have rotator cuff surgery if you feel that you are not suitable for the operation itself, if you have an active infection going on, or if you've been told that the quality of your tendon is probably not up to taking the sutures and holding them in place. In the fullness of time, what we know to happen with these tendon tears is that they do get bigger, and some of them that weren't symptomatic before do become symptomatic. Unfortunately, associated with this, if you don't use the muscle that's attached to the tendon, the muscle can waste away to the point that we can no longer repair the tendon, even if we wanted to. There are alternative ways of controlling the pain if this is the case, though.